Today we're going to be talking about carrying a pregnancy with trisomy 18. So, trisomy 18 is also known as Edward syndrome. It's a chromosomal disorder. The chromosome 18 has a third chromosome instead of two that would be typical. So, about 1 in 2,500 pregnancies has Edward syndrome, and less than half of those are carried to term. So even if the child is going to be carried to term, there's a 5 to 10% chance they will be living past their first year of life. They're going to experience developmental delays, growth delays, abnormalities in their head and in their hands. Um, yeah. So the karyotype that you can see is the third chromosome 18 down here. And that is just going to affect a wide range of things, and the child will have overlapping fingers and hands, and just a strangely shaped head. And like I said, they're going to experience those developmental delays. So some of the questions that are frequently asked is this an inherited disorder? And no, it is not. It's caused by a random occurrence, and it happens when the chromosome 18 splits during conception. And the only thing that really affects a woman to have a higher chance of carrying a child with trisomy 18 would be their age. So um, it's able to happen across women of any age, but as the mother's age increases, the chance increases as well. And the child will not be able to live independently and develop. They're going to experience those developmental milestones later than a lot of kids would. They can still smile and laugh and play and whatnot, but they are going to need help, for the most part, sitting, feeding themselves. Some can walk with a walker, but for the most part, they will need that full-time care. And some recommendations that to parents who are going to have a child with trisomy 18 is you can do fetal heart monitoring in labor if you choose. You can do amniocentesis testing, and this is pretty common to diagnose trisomy 18, as well as chorionic villus sampling, which is very similar to amniocentesis. You can do blood sampling after birth to confirm or not confirm whether or not the child has trisomy 18. You can do special prenatal care and more. Some women can choose to terminate or go through their pregnancy like a typical pregnancy, but your OB will talk you through all of the concerns and options that you have. And there's the rest of the work for it.